This episode is brought to you by Greenlight. Get this. Adults with financial literacy skills have 82% more wealth than those who don't. From swimming lessons to piano classes, us parents invest in so many things to enrich our kids' lives. But are we investing in their future financial success? With Greenlight, you can teach your kids financial literacy skills like earning, saving, and investing. And this investment costs less than that after-school treat. Start prioritizing their financial education and future today with a risk-free trial at greenlight.com/Spotify. Greenlight.com/Spotify.
As a contractor, I don't pay for materials I don't use. So why would I pay for stuff I don't need in my mobile plan? That's why the new MyBiz plan from Verizon Business is so perfect. Now I can choose exactly what I want, and I only pay for what I need.
Right now, with MyBiz plan, get our best price, as low as $25 a line. Visit verizon.com/business to get started today. Price per month with 5+ lines. Includes autopay and paper-free billing and special intro offer discounts. Taxes, fees, economic adjustment charge, and terms apply. Offers end June 10th, 2025.
All right. Good morning, guys, and welcome to the podcast. From Washington, I've got Christopher Colombo, Dr. Colombo, and he is the founder of FunctionalMentoring.com, and he's going to talk to us all about meaning, personal development, optimization, and personal development in the context from a medical doctor. And I'm really happy to have him on to describe his experience and expertise and share value with the audience. Chris, welcome.
Thanks, Chris. Really appreciate you having me.
Yeah. Briefly introduce yourself and we will dive into the questions in the conversation.
All right. My name's Christopher Colombo. That's not a joke. My parents did do that to me. I grew up in New York and joined the Army actually to pay for medical school. I'm a board certified intensivist and internal medicine physician and served 20 years active, 24 years total, and then retired. And a colleague of mine turned me on to coaching because one of the things I realized when I retired was that I could take all of the parts of my military and medical career that I really enjoyed and focus on those and jettison as many of the things that I didn't enjoy. So I love clinical practice. I still work as a night intensivist in an ICU. And I really enjoyed leadership, mentoring, and developing folks. So I've managed to take that piece of my Army and former career and turn it into my business now. Yeah.
And there's a lot of doctors on this podcast. They love this podcast because it's like doctors doing different things and we showcase different businesses, entrepreneurs, startups, medical doctors doing things. When clients come to you, what is the typical client avatar, their pain, frustration, their need, want, or desire that they're trying to solve?
Yeah, so that's really personal for me because I base my niche on my own challenges and experience. The archetype I have in my head is a physician or even a tech entrepreneur in medical technology space. I do some consulting there, but what I lived through and what I see in them is that their talent and their skill elevated them to the opportunity for a leadership position or to start a new endeavor. And what they realize is that all of the skills and credibility that they just had 5 minutes ago no longer counts in their new position. They're untrained for it. They're inexperienced at it, but they're so used to being successful through college, medical school, residency, clinical practice. Everybody listens to them at the bedside. Or as an engineer, everyone listens to them in the lab, and then they get in charge of their own company and they're wondering why it's not going the same. Frustrated, they're burnt out, they're pissed off because what was so successful yesterday is now a disaster that's just sucking their energy. And that's what I experienced in my own career. And I really like to help people get unstuck from that.
Yeah. I can really feel the emotions from your words when you're describing that personal experience and translating into helping others. The next question I have for you is you talked about doctors having an identity crisis. How do you navigate this? What are some typical beliefs or mindsets that helped you during this transition that help doctors? For example, they're like, yeah, I'm no longer a doctor. My life is worthless. What can I do? How do you address these?
I think it really goes down to what are their underlying motivations and really what are their values. Character strengths is a key piece of what I do. And really that ties into the idea of what do you consider your personal virtues? What is most important to you? Because honestly, when someone's able to turn a job into a career, into a calling, one of the things that correlates with that in the positive psych literature, is it in line with your motivations? Are you living out your authentic character strengths and your value? So taking a step back and trying to gain some insight as to, okay, this isn't going well. Could be the job, could be you, probably just a mismatch between the two. So why don't we start with defining who you are, what you really want, why did you choose to be a doctor, and what can you do now to still live out the realization of those values and those motivations?
Interesting. There's a lot of angst. When I used to talk to a lot of doctors as well, colleagues, etc. I don't do as much coaching anymore. I'm more focused on building out a brand. But one of the things I noticed in clients is one is either they are trying to fulfill some expectation that is out of alignment with who they really are, like their parents or helicopter parents or their spouse or some society is, we invested so much into you, so you have to do this. How do you address those clients when they're making these changes?
Yeah, in two ways. One is really, again, that underlying motivations, values. Why do you feel that that's what you have to do or should do? And then practically, and just as a tactic, is looking for those words that lead to those thought traps. So should, must, always, those kind of words just creep in very subtly and they close off creativity and thought. There's a lot of ways that you can fulfill a service desire, service ethic. It doesn't have to be the stereotypical cookie cutter. You're going to be a doctor that works 110 hours a week at the expense of your own happiness, your family, etc. It's almost as if you just have to take a step back and convince people. So is a doctor that works 40 hours a week not better than a doctor that doesn't doctor? Well, yeah, of course that's better. Okay. Is it something that you could sustain versus the current path you're on where you're going to burn out and not be a doctor at all? And then taking a step back, is should is a mismatch in expectations and reality, right? There's very limited control you have over reality. And sometimes a should is a good reminder that you're falling short of something that you really ought to be doing. And it's a reminder, wait, I can adjust this reality. I can work harder. I can be more respectful of other people in the workplace. I can compromise a little bit. I can build consensus. I can be creative and let go of some control and let somebody else solve a problem as part of a team. And then other times you're just deluding yourself, and reality is what it is. And it's your expectation management that is what effect.
Interesting. The other client avatar that frequently encounter, and to some people listening, this could be bringing awareness, is this one that's, they really love medicine. Like they went into it and they love the academic rigors. They love their environment. They really wanted to help people. And then they do med school and residency, and then become an attending, and all of a sudden they're like, this is not what I signed up for. I'm very highly competent. I love to do but I don't want to work in this kind of broken healthcare system. So how do you address those clients?
Yeah, it's a little bit disheartening that we've had to create the term moral injury, right? As the healthcare community. I was actually just doing some night shifts this weekend, and some occurrences, and my a nurse practitioner that I was partnered with and the nurses, we were all just sitting around after a thing that oughtn't to have happened, but happened. We all just, again, embraced reality and made the best of it. But we all stepped back and we said, there's no wonder that the term moral injury has been created. And a lot of it is really just a lack of control, right? You do these things within the system, but you don't control the system. So you either have to accept parts of it out of your control and say, every part of life has pieces that are out of my control. I have to do the best that I can. Or there is the concept of job crafting, where physicians and healthcare providers in general, I think this is a lesson a lot of people learned during the pandemic, was there was such a demand for that skill and that expertise that there was a lot more flexibility and a lot more allowance for doing it in a way that was, sustainable or personally palatable. And I think everybody's, we hit the reset button. Pandemic's over. We can go back to the way things were. I think now that people have seen, wait, as nurses, I can travel and get paid more for my skill, move from place to place, have some other experiences and some other exposures and things that keep me going because I like to travel, meet new people, and I'm still nursing. Or physicians that, after their career is over, like somebody asked me, are you going to join an academic department of university and teach, or are you going to join a private practice? And then they would stop as if those were the only two choices. And my joke when I retired from the Army was I said, no, I'm going to sit home and build Lego for a little while. And they say, are you serious? I said, of course I'm serious. I'm just going to take a few months to just let life settle and be dad and be husband, and then see what the parts I really enjoyed. And I work nights, which a lot of people say, didn't that burn you out? No, because I love being at the bedside. I love taking care of critically ill patients. I love shoulder to shoulder with my nurses at 3:00 in the morning when everything is going to hell in a handbasket and everyone's looking to me to say, okay, now what? And I'm as part of a great team in the IC, right? I surrounded myself with the smartest practitioners in the hospital. And that's my extent of interaction with the medical world, because that's the bit that I liked. And then so now you're coaching and consulting? Yeah, because I enjoyed research. I enjoyed mentoring. So I get to design my own job and do that. Way happier. I'm way less burnt out because I'm picking and choosing the bits that I'm interacting with. And it's part of that creativity of the only two choices are not the only two choices. That's a cognitive trap. One way to get around, because the tilting at windmills, I'm going to fix the healthcare system this weekend. Yeah, let me know how it goes for you. Trying to be personally creative and do the parts that are fulfilling to you. And frankly, are fulfillment of that service ethic that a lot of people do get into medicine. I want to help people. You are. You're not making that bargain with the devil that comes with a lot of the traditional medical career, but it doesn't mean that you've stopped just because you're picking and choosing the best parts.
Yeah, I love that. And during that, you alluded to this idea of all or nothing type thinking and this kind of cookie cutter and kind of this like very one-dimensional, short-sighted way of thinking. And a lot of doctors, and I think it's pressed upon us as pre-meds and as med students that your purpose of going into medical school is to take care of patients. And so that becomes like the gold standard for a career. And what if doctors, and a lot of doctors, they're like, I don't want to take care of patients. I want to do research, or I want to go into pharma or do other things. How do you address this when it's like the whole system is pushing patient care and people don't want to do that anymore?
Yeah, it's really reassuring people. And the coaching aspect really comes in with just getting to the bottom of why it's not obvious, right? If somebody goes into research and pushes forward a cure for cancer or a new treatment for a rare disease or makes a discovery about how the human body works, is that not a service to patients somewhere down the line? And if nobody did those roles, how would medicine progress and treat patients that currently medical science doesn't have an answer for? So just asking those questions of when your brain says, oh, this is the complete opposite of patient care. Is it real? And that stepping back to get a better picture of reality. The principle of humility is, I think, misused a great deal. Most people think of humility as modesty. It's not. Actually, the Greek and Latin root for humility is to be grounded, as if grounded in reality, right? For Reggie Jackson to say, oh, yeah, I guess I was okay as a ball player. That's insane, right? It's modest, but it's insane, right? Shohei Ohtani, if he would just, yeah, I guess I'm okay on the diamond. Everybody would look at it. I'm making an intentionally absurd argument to make the point. That's not humble. That's crazy talk, right? Now, for them to tout I'm the greatest baseball player that ever lived and no one can compete with me is also an insane overstatement. But to be grounded and say, yeah, I'm fantastic at what I do. I work hard at it. And I'm one of the best that's ever played. That's actually a humble statement because it's grounded in reality. So the grounding in reality of these other alternative ways to participate in service to humankind, service to patients, is just a matter of defining the reality. If no one does research, if no pharma company invents a new medication, that's a pretty bleak future, right? And an MD can be a very valuable piece of the puzzle for drug research, device research. I look at it as defining reality and not getting caught in the should trap. A doctor should do this. What does a doctor actually do that can serve patients, and what part of that do you want to participate in?
Yeah. Yeah, I love that. The other question I wanted to allude for the audience and enlighten is, how do you deal with the resentment of physicians against either the hospitals or just like now they have to answer to, for example, one of my colleagues over lunch, he was complaining that now he has to answer to an administrator, and she's like less educated, not as well trained, and he has to like, and or just like hospital CEOs like with no training at all, making 30 times more than doctors. How do you address this in this growing resentment where it's, yeah, we have to follow your rules, but you don't understand anything that we're doing, and et cetera, and making it worse?
Yeah, that's a tough situation, honestly, just the way that the administration of healthcare has evolved and bloomed, blossomed versus the amount of clinician input. That sort of comes into, why isn't a physician in that role? Isn't a physician leading? Why don't you have another doctor that's in that administrative position that does understand you?
Yeah.
Because a lot of physicians don't want to lead. And then the question really becomes why? What is it about that? Is it because we're not trained for it in medical school? You obviously have a responsibility to lead a team when you're a clinician, and you figure it out by trial and error. And some folks are really good at it off the bat, and some are terrible. And you either figure out a way, or your team is asking the same questions of you as a provider, right? The nurses, this person's not at the bedside 12 hours a day. They don't know how to put in a Foley or put a type behind. Why am I taking all their orders? I know what this is. Framing that reality for a physician to be like, you are often in the same role that you now feel as administrators in. And I'm going to guess that your friend used the words must, always, and never a lot in that conversation.
Oh yeah, that's weird.
Should. I have a series on my website about 7 dirty words, and there's a bunch of those little ones that just creep in. So this administrator always does this, or they never listen to me. Really? 10% of the time, they don't listen. And that's a natural thing. It's physiologic. Our brains are wired with a negativity bias, which if we were fleeing from a saber-toothed tiger, great. Anything that's anomalous in your environment when you're 10,000 years ago, if you avoid the danger, you live and reproduce. If you avoid a success, it probably wasn't that big a deal. So the negativity bias is a survival instinct, which is now completely mismatched to our environment, right?
Yeah.
We focus on the negative, and then words like always and never keep us focused on that negative instead of taking a step back and saying, okay, your administrator is not as clinically competent of you. Of course they aren't. What are they competent at that you don't have a clue about? Right? You're a physician entrepreneur. How many physicians have you met that know anything about business when they get started?
Very little.
And we all talk about the hospital would run perfectly without administrators. Really? Really? Have you ever been in a large organization that doesn't have a logistician, somebody doing the books, collecting the money, buying the supplies, ordering them for use? Oh, it just magically shows up in the Omnicell. It's not really how it works. There's a large group of people. I agree, it's overgrown. It's become its own monster. But the first step is taking a step back and saying, look, these folks have a role in a large organization. They facilitate and empower you. And when they're not facilitating and empowering you taking care of patients, that's the thing to bring to them, because that should focus the physician and the administrator both on the mission of the organization. Right? The way to take the personal conflict out of it. I don't have a problem with you. I'm on our mission. These are the things that you're doing or not doing that are not fulfilling the mission. What is the mismatch from an administrative point of view? That's at least the start. And there's always going to be toxic personalities in both the clinicians and the administrative side. And we can focus on the red herring of how much the CEO makes. I think that's just to spin people up and piss them off.
Hilton brings you new ways to stay, with experiences that let you capture the glory days. Introducing the Graduate Hotels. Each inspired by local college towns, these stays are always original and never boring. Get in touch with traditions all across the country and enjoy a stay that's a class above the rest. Book at Graduate Hotels with Hilton Honors Points at Hilton.com. It's a win-win. Hilton, for the stay.
You know that feeling when someone shows up for you just when you need it most? That's what Uber is all about. Not just a ride or dinner at your door. It's how Uber helps you show up for the moments that matter. Because showing up can turn a tough day around or make a good one even better. Whatever it is, big or small, Uber is on the way. So you can be on yours. Uber, on our way.
Yeah, it's quite interesting. I was reading this report where like the health insurance executives were like, it's outrageous. And there was something on social media where like this surgeon got a penny reimbursed for this like huge operation. And it's so, on a positive note, how is your thoughts of healthcare? Obviously, healthcare, the system is antiquated. It really needs a revamp. And we've seen some changes, but do you think it's just going to be like the same thing? It's going to be like platitudes and it's going to be like bureaucracy, regulation, and basically, is medicine still a good profession to go into, or should people be looking into other things? Just curious to hear your thoughts.
Yeah, that's a great question. I often get asked, would you do this again? Yes. As you said, end on a positive note. Looking back over my entire career, I'm a firm believer in the butterfly effect in your past. Oh, I could change this one thing and nothing else would change. Not how any of this works, right? You are exactly where you are because of all of the decisions that you've made, the ones that worked out, the ones that didn't, all the other things that were out of your control that affected you. You're here now. You can either be despairing of where you are, or you can be content with where you are, even if you want to improve and get better and learn from those mistakes, but you can't undo them. So just take that as an option off the table. So would I do this again? Yes. I love my life, right? Clinician, and having done that is an important part. I think hopefully what we see is more creativity and less, like you said, platitudes and cookie cutter. I think and I'll be very honest, I see the revulsion and the reaction to anything that is a little bit different. Take concierge medicine. I can't believe I'm about to start a sentence with when I was a resident. When I was a resident years ago, that was just becoming part of the landscape for clinicians, right? And everybody was losing their mind. Is it ethical? Is that even a question? You don't like it, and you have to answer the question, why don't you like it? Probably because you're jealous because you're not able to. And you're looking at this person going, wait, they have a small panel of patients that pay them directly and a fair amount. They get to take direct care of those patients in a way that they're fulfilled doing and the patient's happy. The next question should be, is that ethical? The question should be, what are the outcomes for that? And is that a thing that we should be promoting because it works better? We don't get there because everybody takes that personal, man, that's not working for me like that. No one should be able to do something that I, can't do that isn't working for me. So I think in the tempest in the teacup of concierge medicine there's a lot more of it now. And people can choose it or not, both as a provider and as a patient. And it actually opens up potentially the psychological bandwidth and spiritual bandwidth for somebody who's in concierge medicine to have some time to do pro bono medicine versus I'm so burnt out, quote, in the system, I can't do anything that's altruistic or of service. So there's some benefits of it where you're like, wait, this worked out different than everybody was predicting the catastrophe of 20 years ago. And I look at that hopefully and say, somebody did something different and it worked. And now we have a new aspect of medicine. What is the next creative bit? Is it you coach entrepreneurs, you help people build their business. I hope that there's a lot of physicians that get some personal validation and fulfillment, create another aspect of their life. And like me, are they rejuvenated and they're actually able to do more clinical work over the next 20 years than they would have if they just kept marching through, burnt out, quit the whole thing when they got enough money to retire? Is creativity and a little bit of individuality an answer for all of that? I hope so. It's not just to validate what I'm doing, although that's certainly part of it. I'd like to think that the path I've chosen is a right answer. I have colleagues doing similar. They're getting into service to other physicians or leadership and policy, right? A lot of us don't realize that they have an incredible voice, an incredible amount of credibility because of what they've been doing clinically. Now they're meeting with representatives, they're helping advise lobbying agencies or nonprofits about, hey, how can this policy be different to actually help versus arguing with their administrators, which we all know is going to go nowhere, right? So create a different path. I'm hoping those flourish and that people get the answer of it does not just have to be you do pre-med in college, you go volunteer at an emergency room, and then you get into medical school, and then you pick a residency, and then you go through residency, and then you pick a fellowship, and then you join a private practice, and then the next 30 years of your life is god awful, but eventually you get to retire and then go be happy. You can make other choices in between and try to be a little bit happy now and do something that's more fulfilling, because all of these roles, they need to be done, right? If we just had every physician as a clinician, worker bee, drone, right? None of them in policy, none of them in leadership, none of them in entrepreneurship, none of them in research. Take a think on that. What would medical science and the medical establishment look like?
Yeah.
Bigger disaster than it is now. So I think encouraging that creativity and letting people do a little bit different approach to service of the whole system is a better way forward.
Yeah. How can people contact you and visit you and reach out to you and learn more from you?
Yeah. So I'm on LinkedIn, Christopher J. Colombo. I look like me in my picture. FunctionalMentoring.com. And then there's also a Functional Mentoring page on LinkedIn. But yeah, www.functionalmentoring.com. All one word, no spaces or underscores or anything. That is mine and my collaborator in chief, Paul. We've known each other since we were intern resident together. And he's a fellow former military medical leader and clinician who's on the journey with me of how do we do things a little bit different and help other folks do things a little bit different so we can all contribute in our own way.
Excellent. I really enjoyed talking with you, and keep up the great work. We need doctors that are thinking outside the box and doing different things and helping serve the patient community in different ways. And I really enjoyed. Thanks so much for coming on to the podcast.
Thanks, Chris, for having me. I really appreciate it.